Ever since I was little, everyone has said that me and my mom are very similar. When I was in high school, she actually went back to nursing school. I have these memories of her coming home and just glowing about patients that she took care of. And the way that she spoke about it and the way that I could sense she felt about it just made me think that it would be right for me too. Growing up, my sister was sick for a short period of time. I always noticed that I felt this sense of panic when people around me were sick. I felt really uncomfortable not knowing how to react to that, and I just had this desire to be able to take care of people when they needed help. I ended up going to nursing school as my undergraduate degree, and I was pre-med at the same time, but not sure if I wanted to go all the way through to med school. So I ended up working for 3 years as a critical care nurse and then came to med school. One thing that I really liked about Weill Cornell when looking at medical schools was the appreciation for students coming from different backgrounds like I was. Having a diverse class adds a lot to the culture of the school and helps us in the way that we're able to approach patients. I think it's really great that Weill Cornell offers scholarship support to so many students. That was actually a big factor in my decision to come here. There's so many opportunities when you're first starting out to get involved with research.
I met Rachel when she was just finishing her first year of medical school, and she was applying for the MSTAR summer research program in aging here.
Dr. Adelman did a wonderful job at sort of making the geriatrics division a home for me, somewhere where I could always go for guidance or inspiration.
I think it was perfectly pivoted. So it's been a wonderful evolution of getting to know her, and my hope is that Rachel stays at Weill Cornell.
Going through med school, I think there was a little bit that I liked about each rotation, but I never felt I had found 100% what I was meant to do. When I had the opportunity to rotate on anesthesia, it just really clicked.
When Rachel and I first met, she was just really discovering the specialty. Then, once we decided that I was going to be her advisor, we met on a very regular basis.
His passion for the specialty was very inspiring to me from the beginning, and he's just remained a wonderful resource to sort of bounce around ideas as I go through the match process.
Rachel needs a challenging residency. She needs an environment that is going to push her to her limits so that she can realize all her potential.
We spent a couple of months in fourth year interviewing at programs within the specialty that we're interested in. And at the end of the interview process, we all make a list of the programs that we're most interested in. And at the same time, the programs make a list of the applicants that they're most interested in. After some fancy algorithm matches up the lists, on match day, we find out where we're going to end up.
One of the things that we discovered from getting to know Rachel was just how much we want her to be a part of our program.
It can be pretty nerve-wracking to just kind of put your wishes out there and trust that somehow the system is going to work out so that you end up in a place that you want to be in. It's important to just have faith that the place that you end up is going to be the right place for you.
We're really hoping when everybody opens up their envelopes on Friday that Rachel is going to match with us.
Today's match day, very exciting day. We found out earlier in the week if we matched, and I matched, so I'm very excited. And we're gonna find out in a few minutes where I'm gonna be going. At Weill Cornell, so excited. My first choice. I feel very grateful to the donors who have helped to lessen the burden that I'll face after med school, and overall I just feel very lucky to have gotten my education here.